venipuncture via the butterfly needle system. Introduce yourself and explain the procedure to the patient, speaking at their level of understanding while identifying that you have the correct patient. Open the package of the butterfly needle system. If using the multi-sample needle, connect the needle to the vacuum tube holder or adapter. If you're using a syringe and the butterfly, attach the butterfly to the syringe and place the collection tubes in a rack for later transfer of the specimens from the syringe to the tubes. Select the first tube and gently place it into the tube holder, being careful not to puncture the rubber stopper with the needle in the holder. Select a puncture site and apply the tourniquet. Have the patient close their hand and place their arm in a downward angle. Do not have them pump their hand open and closed. Cleanse the site with an alcohol swab or prep with one firm swipe and avoid touching the skin after cleansing. Hold the wings of the butterfly together with the bevel up. Draw the skin below the site taut with your finger by placing it 1 to 2 inches below the intended puncture site and pulling back. Line up the needle with the vein and smoothly insert it into the vein at about a 5 to 10 degree angle. The point of the needle should enter the skin about 1/4 of an inch below where the vein was palpated. Once the vein has been entered, do not move the needle from side to side. Do not push down or pull up the needle. The needle can be gently moved in or out to locate the vein. Let go of the skin and use that hand to grasp the flange of the vacuum tube holder and to push the tube that is in it forward until the short needle in the holder has completely entered the tube. Do not change hands while performing the venipuncture. The hand performing the venipuncture is the hand that is holding the vacuum tube holder throughout this entire process. The other hand is the one that exchanges the tubes as they are filled. It is helpful to rotate the tube in the holder so the label is facing down and you can see when the blood flow stops. When the flow ceases, gently remove the vacuum tube from the holder. Do this by grasping the filled tube with the fingers and palm of your spare hand and use your thumb to push off from the flange of the holder. Immediately mix the blood in any anticoagulant tubes by gently inverting them several times before laying them down or placing them in the tube rack. Insert the second tube onto the needle in the holder by using the same motion as you did for the first one. Let it fill, then remove it the same way you did the first one. Gently invert it several times if it has an anticoagulant tube. When the last tube has been filled, remove it from the needle and holder. Ask the patient to open their hand while you release the tourniquet. If you are filling a syringe, once it is full, ask the patient to open their hand while you release the tourniquet. Lightly place a cotton ball or folded gauze above the puncture site and remove the needle in one pull. Implement the safety mechanism on the butterfly needle. Apply pressure to the site for 2 to 3 minutes or longer if the patient is taking aspirin or another anticoagulant. The patient may assist you by holding pressure on the site, and they can elevate their arm but do not bend at the elbow. Dispose of the needle in the sharps container and any other contaminated waste into a biohazard container. When sufficient time and pressure have been met, apply a small pressure bandage to the draw site by either applying a dry cotton ball or a folded gauze over the site held in place by either adhesive bandage or by tape. If the patient is allergic or sensitive to latex, paper tape can be used. Direct the patient to remove the bandage in 20 minutes. Place the specimen and the requisition into a biohazard transport bag. Make sure to follow your practice policy for storage or for pickup.